Alzheimer's disease, a Pecha Kucha style presentation by Lacey Quinn. Alzheimer's disease is the most common form of dementia, which is defined as the loss of cognitive functioning, or thinking, remembering, and reasoning, and behavioral abilities to such an extent that it interferes with a person's daily life and activities. Alzheimer's disease has no known cure or cause and is ultimately fatal. Alzheimer's disease is the sixth leading cause of death in the United States and is the only cause of death in the top 10 that cannot be prevented, cured, or slowed. 1 out of every 3 seniors in the United States dies of Alzheimer's, and 2 out of 3 of Alzheimer's patients are women. It is estimated that as many as 5 million or more U.S. adults over 65 may have Alzheimer's. Alzheimer's disease has no known causes, although many factors have been identified. It is likely that the disease is a combination of genetic, environmental, and lifestyle factors as well as age. There is a great deal of research in the associations between cognitive decline and vascular and metabolic conditions such as heart disease, stroke, high blood pressure, diabetes, and obesity. Recent research has shown that a healthy diet, physical activity, social engagement, and mentally stimulating activities, along with other factors, can help to reduce the risk of cognitive decline and Alzheimer's disease. Although the causes of the disease are unknown, there are several abnormalities found in Alzheimer's patients' brains that are not seen in healthy brains. The 2 most hallmark of these are plaques, or microscopic clumps of a protein fragment called beta amyloid, and tangles, which are twisted microscopic strands of the protein tau. There is a period of as many as 10 years before symptoms appear in Alzheimer's patients in which the changes taking place in the brain, but symptoms are not yet manifesting themselves. This is called the preclinical stage. Early signs and symptoms of Alzheimer's disease include memory problems, decline in word finding, vision and spatial issues, and impaired reasoning and judgment. Alzheimer's disease can only be definitively diagnosed after death by autopsy. However, several methods and tools have been developed to determine whether a person has Alzheimer's. These include asking questions about overall health, ability to carry out daily activities, and changes in behavior and personality. Doctors can also conduct tests on memory, problem-solving, attention, counting, and language, as well as brain imaging. After the preclinical stage, there are 3 stages of Alzheimer's: mild, moderate, and severe. Most people are diagnosed in the mild stage. Symptoms manifested at this time include getting lost, trouble handling money and paying bills, repeating questions, taking longer to complete normal daily tasks, using poor judgment, and mood or personality changes. In the moderate stage, damage occurs in areas of the brain that control language, reasoning, sensory processing, and conscious thought. Because of this, memory loss and confusion grow worse, and people begin to have difficulty recognizing friends and family. They may also be unable to learn new things, carry out tasks that involve multiple steps, or cope with new situations. This may also include the development of hallucinations, delusions, paranoia, and impulsive behaviors. In the severe stage, patients cannot communicate and are completely dependent on others for their care. Near the end, this person may be in bed most or all of the time as the body begins to shut down. As mentioned before, Alzheimer's disease has no known treatment or cure at this time. However, early diagnosis is key for several reasons. Early diagnosis can help to preserve cognitive functioning for as long as possible and also allows families time to prepare themselves for the course of the disease. There are currently 5 medications approved by the FDA for use with Alzheimer's, and these medications are used to temporarily help memory and thinking problems. They are Aricept, Razidine, Namenda, Exelon, and Namzaric. While these medications can help to temporarily preserve memory and cognitive function, many researchers believe that future treatments to cure Alzheimer's will involve a cocktail of drugs used to target specific areas similar to cancer or AIDS treatments available today. Currently, there is much research being done on the causes and potential cures for Alzheimer's disease. Much has changed in the field of Alzheimer's research since its discovery in 1906 by Dr. Alois Alzheimer, who first described it as a peculiar disease. Fast forward to 2011, President Obama signed the National Alzheimer's Project Act into law. This was the first ever framework for a national plan to address the Alzheimer's crisis in the United States. Today, barriers to research include a significant lack of funding as well as a strong need for volunteers for clinical trials. Alzheimer's is estimated to cost the United States $226 billion in 2015 alone, and this number is expected to rise to $1.1 trillion by 2050. Alzheimer's research is necessary for the health of our future generations, as well as for the financial state of the United States. please consider donating or participating in clinical trials if you are able.